Castle Connolly has an esteemed reputation of highlighting excellent physicians who deliver quality patient care, who exude empathy and demonstrate what it means to have a trusting relationship with your physician. Castle Connolly top doctors are leaders in their field who exhibit those qualities. To be included with a group of phenomenally talented individuals is truly an honor that I do not take lightly. At JFK Johnson Rehabilitation Institute at Hackensack Meridian Health, we are nationally ranked as one of the best rehabilitation hospitals in the country. Being a 2024 Castle Connolly Top Doc is a career achievement that is unparalleled. The nomination of this award by my peers is especially important. Being nominated by your fellow physicians demonstrates that your colleagues trust and value your unique contributions to patient care and to the local community in which you serve. Due to their tireless dedication and unwavering spirit, many top doctors have an impact within their chosen specialty and the medical field as a whole. So as a child, I was always interested in math and science subjects in school. I had an inquisitive mind and would always question why something in particular would happen. As I got older, I became intrigued by the intricacies of the human body. I wondered if I could be a doctor, but I didn't know any Black doctors, so I wasn't sure what that path would look like for someone like me. As a teenager, I was an active athlete, but succumbed to several sports-related injuries. During my physical recovery, I worked closely with the athletic trainer at the high school. Again, the inquisitive part of myself found myself excited to study bones, muscles, and nerves on my own, and would seek out additional information from the athletic trainer and other teachers quite often. When I started my undergraduate studies in college, I was on track to become a physical therapist, but I still loved the body as a whole. Although I could see myself as a physical therapist, there was still a part of me that wanted to be a physician. In my college anatomy class, my professor mentioned a specialty which combined my love for rehab with being a physician. She introduced me to the specialty of physical medicine and rehabilitation, and I've been hooked ever since. Rehabilitation medicine physicians are medical doctors who have completed training in the specialty of physical medicine and rehabilitation, or PM&R. Rehab medicine physicians focus treatment on function and have a broad medical expertise that allows them to treat disabling conditions throughout a person's lifetime. Based on a person's functional limitation, they diagnose and treat disabling conditions by determining and leading a treatment and prevention plan. They also lead a team of medical professionals, which may include physical therapists, occupational therapists, speech-language pathologists, and other medical and healthcare professionals. They can also work with other physicians, which may include primary care physicians, neurologists, orthopedists, and many others. I have a subspecialty certification in brain injury medicine, and I currently take care of individuals primarily with stroke, brain injury, and other neurologic disorders. PM&R physicians can also hold subspecialty certification in spinal cord injury medicine, pediatric rehabilitation medicine, sports medicine, and pain medicine. The specialty is an extremely rewarding specialty, and we have the honor of helping individuals and their families achieve their goals of improved functional performance in the face of disability. It's a privilege to be a physician providing healthcare, and it's an added responsibility and distinction to be a Black woman physician providing healthcare. There's ample evidence from research regarding healthcare disparities that disproportionately impact the Black community in the United States. Black Americans suffer from worse health outcomes like lower infant mortality rates and lower overall life expectancy. And what's worse is that during those shortened years that a Black person is living, they have a higher prevalence of chronic health conditions like obesity, hypertension, and diabetes, including some of the major causes of death like heart disease, cancer, and stroke. Now, we know that many of these inequities stem from socioeconomic factors, including social determinants of health, which are conditions in which people are born, grow, live, work, and age. Examples of social determinants of health are consistent access to food and housing, economic stability, living in a safe neighborhood, having a higher education, and access to quality healthcare options. The future that we aim to embrace is one where health equity is not fought at the individual level, person by person, but that the foundational healthcare systems are established that support the social, economic, and physical health of all persons. So my work continues to be in providing a voice for those who are traditionally and systematically marginalized by the healthcare system and in society in general. My specialty of physical medicine and rehabilitation espouses the principles of treating the whole person, not just the body part. And we have specialized training to understand how the impairment of the body and the functions and structures, like leg weakness, can limit a specific activity, like walking, and result in participation restrictions, like limited household or community mobility. My unique experience as a Black woman helps me to relate to my patients and their families on a different level. There's an unwritten level of empathy and understanding and trust that comes from having a physician who listens to you and who can relate to you. Research shows that when the race of the patient and the physician match, a concept also known as racial concordance, it can actually improve communication, trust, and adherence to medical advice. In my practice, I treat persons recovering from stroke, and many of the risk factors for stroke and heart disease are hypertension, diabetes, high cholesterol levels, and obesity. And unfortunately, these are the same chronic medical conditions that plague the Black community more than other racial and ethnic groups. So in my practice, I became frustrated seeing patients who could have been my grandparents, could have been my aunties, my uncles, or my cousins, and they're presenting with these devastating disabilities in disproportionate numbers. So my role as their physician is not only to help them recover from their disability, but also to help them achieve overall health and wellness by addressing the underlying medical conditions that have led them to may have had the stroke. I now know that I am meant to do this work, to help my community and others live happier and healthier lives, partnering in a trusted healthcare provider like myself. There is so much advice that one will need across the various stages of their career. Several overarching principles that remain true, regardless of what level you are at your career, are to remember your ABCs. So we'll start with letter A. Be authentic, true to one's own personality, your spirit, and your character. As a member of a racially underrepresented group, you have a superpower. Lean into that reality and embrace that gift. Letter B, be brave. So showing mental or moral strength in the face of danger, fear, or difficulty. Bravery does not imply the absence of fear, but the courage to act in spite of fear. Be brave in your professional career and for healthcare advocacy at all levels. And lastly, letter C, be confident. Showing assurance or self-reliance in a world where you may be different compared to others in the room. Be confident in your own abilities because you too deserve to be there. When you keep these foundational pillars as your anchor, there's nothing you can't accomplish.